Hello everyone, I'm Dr. Reshmi. Today I'll be speaking to you all a very interesting topic, that is knowing about your thyroid, the body's master regulator. Now, what is a thyroid gland? The thyroid is a small butterfly shaped gland which is located at the base of your neck. It's a vital part of the endocrine system, responsible for producing and releasing hormones, primarily thyroxine, that is T4, and triiodothyronine, that is T3. The functions of the thyroid gland. The thyroid hormone acts like an accelerator, regulating your metabolism, heart rate, and body temperature, growth, and development. Now, metabolism means how your body uses your energy, and growth and development, especially in the children. The different types of thyroid diseases are there. Thyroid disorders generally fall into two main categories on hormone production, that is hypothyroidism, that is underactive thyroid. The thyroid gland doesn't produce enough thyroid hormone. The most common cause of it is Hashimoto's thyroiditis, an autoimmune disease where the immune system attacks the thyroid. Other causes, iodine deficiency, less common in regions where the iodized salt is not available, thyroid surgery or radiation therapy. Hyperthyroidism is the overactive thyroid. The thyroid gland produces too much of thyroid hormone. Most common cause is Graves' disease, an autoimmune disorder that stimulates the thyroid to produce the hormones. Now, what are the other causes? You have the toxic thyroid nodules, that are lumps that overproduce this hormone, or thyroiditis, inflammation. Other common conditions are goiter, an enlargement of the thyroid gland which can occur, and both hyper and hypothyroidism, often due to caused by iodine deficiency. Thyroid nodules, there are lumps of growths in the thyroid gland. Most are non-cancerous and benign, what we called as thyroid cancer, though rare, but it involves malignant growth of the thyroid cells. The symptoms of thyroid conditions are often opposites and can be subtle, mimicking other conditions. Like hypothyroidism, too little hormone or it produces slow metabolism. You get a fatigue, tiredness, you have unexplained weight gain, increased sensitivity to cold, dry skin and coarse hair, constipation, slow heart rate, depression, forgetfulness, heavy or irregular menstrual periods. Then in hyperthyroidism, you get to know nervousness, anxiety, you may be irritable, unexplained weight loss is there, increased sensitivity to heat, mostly you get clammy skin, moist clammy skin, fine brittle hair, frequent bowel movements or diarrhea, rapid heart rate, that is increase in heart rate called as tachycardia, or palpitations. You might get tremors or shaking hands, irregular or light menstrual periods. Now, what are the causes and risk factors? You have the autoimmune diseases. The most frequent cause is the body's own immune system, which is mistakenly attacking the thyroid. Hashimoto's and Graves' disease. Iodine imbalance. Too little iodine can cause hypothyroidism and goiter. Too much iodine can sometimes trigger or worsen hyperthyroidism. Genetics. A family history of thyroid disease increases your risk. Gender. Women are significantly more likely, that is 5 to 8 times, than men to develop thyroid condition. But doesn't mean that the men should avoid thyroid testing. They should also go for it. Age. Risk increases with age, particularly after 60 years. Pregnancy. Postpartum thyroiditis can occur after childbirth. So you should check your thyroid hormones after your childbirth, which most of the women in our country doesn't do it. Radiation therapy to the head or neck. Diet and nutrition. It plays a vital role. Focus on a balanced diet rich in whole foods, fruits, vegetables, lean proteins, and healthy fats. Stay well hydrated. Drink plenty of water, as water supports metabolic and digestive processes. Limit processed foods, excessive sugar, and inflammatory foods. The key nutrients you should include are iodine, essential for hormone production, found in iodized salt, seafood, and dairy. But there's a caution: if you have an autoimmune thyroid condition, excessive iodine, like kelp supplements, can sometimes worsen it. Selenium, important for thyroid hormone metabolism, is found in Brazil nuts, tuna fish, and eggs. Zinc, it helps in thyroid hormone synthesis, found in oysters and pumpkin seeds. Considerations: hypothyroidism, some people may be sensitive to very large amounts of goitrogenic foods. Cruciferous vegetables like raw cabbage, broccoli, cauliflower. Cooking these foods typically deactivates the goitrogens. Medications interactions: if taking levothyroxine for hypothyroidism, do not take it at the same time as calcium or iron supplements or with high fiber food. Wait at least 4 hours. Just count on this point. Lifestyle management. This is a very crucial point and it plays a lot of influence. Medical treatment and improve overall well being. Stress management. Chronic stress can negatively impact your endocrine system, including thyroid function. Incorporate practices like yoga, deep breathing, or hobbies. Regular exercise, physical activity supports metabolism. It improves food, mood, and helps to manage weight. Important for both hypo and hyperthyroidism. Adequate sleep. You should at least aim for 7 to 9 hours of quality sleep per night. Poor sleep can disrupt your hormonal balance. So go to bed early. Avoid using your mobile too much or watching TV. Avoid smoking. Smoking is a significant risk factor for Graves' disease and can worsen thyroid eye disease. Now, what are the key takeaways? Do yoga every day. If you experience persistent symptoms like